Jesse Byrnes is an associate editor for The Hill and joins us now from Washington. So it wasn't just the passage of the bill that people have been talking about since yesterday. It was also sort of that celebration that ensued. We saw it in the Rose Garden. You put that alongside the fear that some people have right now of losing coverage or just being uncertain. What was your biggest takeaway yesterday?
Yeah, it was really quite remarkable to see the president having this big celebration after having legislation only pass one chamber of Congress. Typically, we wait to see that until the legislation becomes law and he actually signs it. But look, I mean, the Senate Republican leaders acknowledge this is going to be very difficult to actually get this legislation through the Senate. And although it did pass the House, and that was a big moment, it's a long road to actually seeing this become law and actually repealing key aspects of Obamacare. It's a much difficult path, more difficult path in the Senate.
Yeah, you say a difficult path in the Senate. Any idea what we can expect as it starts going through the Senate now?
Well, we've already seen several Senate Republicans come out and oppose the bill that passed the House, and their biggest concern is the rolling back of the Medicaid expansion of Obamacare. These are states that already expanded Medicaid, and they don't want to see those subsidies really from the federal government go away. And so what we're seeing from Republicans now in the Senate is a working group of about a dozen or so lawmakers on the Republican side trying to come up with their own legislation, essentially. Of course, for anything to become law, the House and the Senate bills eventually are going to have to be reconciled, and they're going to have to agree to that. But at this point, Senate Republicans are trying to at least see what they can come to agreement on. You
mentioned that Medicaid expansion rollback as the bill stands right now. Didn't President Trump campaign saying he would not, or promising that he would not cut Medicaid?
Yeah, and what you're seeing is places like Ohio or Nevada or even West Virginia, areas where Trump got more support than Republicans traditionally get. Those are states where we're seeing senators on the Republican side come out and say, look, we've already expanded Medicaid under Obamacare, and rolling that back is going to negatively impact our constituents. And so you're going to see some pushback from them. So that's going to be a major concern. But if they change the bill, try to soften it, it's going to be interesting to see if they can get the conservatives on the other side to actually come on board with those kind of changes.
And Jesse, when you look at the bill as it stands now, I mean, will the Senate Republicans, the Senate in general, will it be changing the bill, or is it sort of like scrapping it and starting over?
Yeah, the language that we saw yesterday from Lamar Alexander, who is the chairman of the Senate Health Committee, was essentially saying that we're going to, if there are good ideas in the House health care bill, we're going to borrow them. And so it seems like Republicans are going to basically start fresh, and they're going to kind of push their own vision of what this looks like. The Senate is more moderate, of course, and there are only 52 Republicans. And so if Republicans try to pass a health care bill through budget reconciliation, or essentially trying to get it through with only a simple majority, they can only afford two defections. They can only afford two Republicans bucking the party, and so that's going to really force them to bring in all members, including those moderates who don't want to see the Medicaid changes rolled back. I
started asking you sort of about that celebration that we saw a little yesterday. Also, just President Trump in general, his influence at this point in getting this passed in the House we saw. What are we learning about a Trump presidency in that regard?
Yeah, I mean, there's a lot of heightened pressure on Trump, but also his top aides. We saw Reince Priebus, the chief of staff, really get a big win yesterday by having this health care bill come to, pass the House. And of course, Reince Priebus and Speaker Ryan are very close. There's going to be some added pressure we would expect on even Vice President Pence going forward now that it moves to the Senate. He's been attending weekly lunches with Senate Republicans, and so he's been, cultivating those relationships and keeping those going forward. And so yeah, as far as Trump's governing ability itself, he's touting this as a big win and already framing the next phase of this, describing it as phase 2, but acknowledging that this bill is going to change as it moves to the Senate.
We hear so much about Trump, the great negotiator in business. What's the feeling in D.C. right now? Is he that great negotiator?
Yeah, I think we're saying we're past the 100-day mark, of course, and so we're seeing that it's more difficult. He's acknowledged it's more difficult to try to get legislation done and govern in general. It's the first office that he's ever held, and so he's learning that there are many more interests involved in trying to get governing done and legislation through Congress. And some of the the rulemaking, the legislating itself is complicated, having to go through different committees on the Hill, having to go through different formal rules and processes to try to get things done. He's learning, on the job how complicated that really is.
You've got to work with others. Jesse Byrnes, Associate Editor for The Hill. Thank you.
Absolutely. Thank you.